So let's back up a minute, and what is the social return on investment? Well, first, the social return on investment, it assumes that you are in the business of social change. So because of your mission, because of your nonprofit status or government entity status, the reason that your organization exists is to create some benefit, some public benefit, some value into the community. So just like a for-profit organization would, tell their investors, they would say, hey, will you give me $1 million and I will turn that $1 million into $10 million for you, right? Then that's the ROI, 10x. They're going to 10x their money. So your investors are your funders, and your funders aren't investing because they expect a monetary return to them, right? Your donors don't say, here's $100, I expect $200 back into my pocketbook. No, what they hope to see is some sort of public benefit. So you're going to take their $100 and generate some sort of public benefit, public return, and be able to communicate to them how your programs, how their investment into your programs are changing lives, and as a result, either saving community costs or increasing financial benefit to the community in which you serve. And so everyone, and this is the fun part about this work, is that unlike if I were teaching this particular webinar to in the business community, well, the formula would be the same for everyone. Dollars in, dollars out, revenues in, revenues out. Like, it would be really easy to tell someone how to calculate the formula. But the challenge and the excitement in the social sector is that each one of you are unique, and your public value, your public benefit is going to be different. And so we're going to talk about how do we think strategically in terms of how do we calculate that and how do we communicate that. All right, so as I am doing, walking through this program, it is really based on one particular case study. We have lots of case studies that we could give, but I felt like it'd be best to just kind of outline what one great organization has done, and you can follow along. And so we are going to, our example today, if you will, is the wonderful Center of Hope in Toledo, Ohio. They're a youth and family serving nonprofit that serves kids, urban children and families in Toledo, and they have done an amazing job at being able to calculate their social return on investment. So again, Center of Hope wanted to be able to communicate their social return on investment. And so here's the bottom line picture, and I'm going to teach you exactly how they did this, and hopefully it will inspire you to think about how you can do this for your organization. So again, Center of Hope is working with very high needs, high-end families. And across all of their programs, their average success rate was about 63%. So we can argue whether this is good or bad, but it is what it is, right? They're very transparent, very open, and saying, in some cases, in some of our programs, we work with very, very high needs families, and their success rate is about 43%, but it's still better than the alternative. So when we looked across all of their programs, and I'm going to really dive into this in the future, but they had a 63% success rate. Why this is important, that you have to start with your outcomes, you have to start with your success rate, is because now that's going to allow you to start with an empirical approach. Because if we just assumed that 100% of the people that we serve are successful, well, you may be wrong, right? I mean, Center of Hope would be wrong, and you're going to overinflate your social return on investment. Because for those 47% of the population, or 37% of the population who's not successful, well, you don't get a public value there because they didn't receive that public value. So we have to back them out of our equation. The next thing we knew about the Center of Hope, because we knew what their success rate was, we knew their outputs and the number of people they served, is that their cost per success was a little over $2,000. So basically what that meant, what they could tell their funders, is for every $2,000 you donate to the Center of Hope, we can get one family to a successful outcome. It's not cost per service. Their cost per service is actually lower than that, but we kind of accounted for that failure rate. Again, I'll go into much more detail about how to do that. But now they can say, can you say that about your organization? Can you say for every, how much it costs to get to one successful outcome? So they were able to do that. Then they also were able to say, however, for every successful outcome we achieve, we save the community $16,461 in community costs. So yes, we have this success rate, but we folded in our failure rate into our cost per success. So for every $2,000, we're going to turn a $16,000 savings for our community, which is a 594% since social return on our investment. And their food program was like off the charts. It had a gigantic social return on your investment. So I'm going to show you exactly how they did this. So 3 primary steps you need to do before you can calculate your social return on investment. The first thing you need to do is to do your research. Actually, it's the third thing you need to do, but you just need to do all these 3 things. So you need to do your research. You need to understand what is the public benefit that your services provide. Do you increase economic development in your community? Do you, if you're keeping people out of jail, are you reducing the amount of time people are spending in jails? Are you keeping people out of hospitals or institutions, so you're reducing the community cost? Are you increasing people's income by moving them from high school graduation to high school dropout, and so looking at the difference of their earning potential? Are you reducing their dependence on, your clients' dependence on public benefits? So you really need to think strategic, and this is more of a theoretical exercise, but we're eventually going to turn it into an empirical one, and say, if my clients are successful, what are they no longer experiencing? What benefits to the community are we saving? Or on the other side, what benefits are we providing to our cities, to our residents, to our communities? Second, we need to define and know your outcome measures. This is key. We have to identify how do your programs change lives and change circumstances, get very clear on that, and have measurable outcomes related to those changes. And then you have to establish your baseline, which is really, what is your success rate? What's percentage of your clients are achieving that successful outcome? So those are the 3 pieces that we need to have to tell our social return on investment story like Center of Hope did. All right, so now let's get our thinking caps on. And here is how we're going to determine our success rate. That's going to be critical to our calculation. So I want you to ask yourself, how do we define success? All right, so I'll give you some examples. In the Center of Hope's case study, they defined success in some very specific ways. So they had 4 different types of programs, and each different program had a different success measure, outcome measure. So their after-school program, they defined success by improved school attendance. They had a family navigation and wellness program, which they defined success about, it had to do with custody and other things, that their parents better understood understanding their DNA case. So they had a much better understanding of the process, how to navigate it, how to work with it. They had a juvenile delinquency program, which looked at juveniles released from the detention center through their diversion. And then they had a workforce development program, which looked at the percentage of people who obtained employment for 90 consecutive days. So you can see they had 4 very distinct programs that were all trying to achieve very different outcomes. So for each program, they had variable success rates. The juvenile detention one only had a 44% success rate, where the improved school attendance was at 97%. So they looked across all of their programs to get an overall average of success. So that's where they got their success rate. So again, clear outcome. It's going to be unique to your particular organization, and you're going to need to know the success rate. So then you need to know, how many people did you serve? That's an output. You should probably already know how many people you serve in each program. Then how many people hit that target? So, you know, if you serve 100 people and 97% people hit your success target, you'd be 97% successful. So that's your success rate. So hopefully, once you have a defined outcome, you know how many people you serve, you know how many people achieve that outcome, and you'll have a success rate. First step. So now we need to determine your program's cost per success. This is my most favorite measure of all measures ever invented, because it allows us to tell our impact story in a real way where funders can get excited. Because you're not just saying, it costs me this much money to put people through our program. So for example, the Center of Hope, their whole entire program cost is like $1 million. Well, that's pretty overwhelming and daunting to say, we need $1 million every year just to run our programs. That feels like a drag on society. It feels like a drag on donors. But instead, if you can start to communicate your cost per success, people now know what they're buying. They know what, you know, great, $2,000 gets me one successful family. Okay, I want to do that. Here's my check. Here's my $2,000 check. And another great thing about cost per success is that you can measure that over time. Because maybe at a 63% success rate, your organization says, I'm not okay with that. I want to be at 75% success rate. But to be at a 75% success rate might actually require more resources to my program. So we need to make sure, but when you talk about cost per success, you actually can increase your program's budget and increase your success rate at the same time, and you will be able to deliver the same cost per success, right? So we want to make sure that we know how much it costs to get to one successful outcome. So this is a very, very easy calculation. You just take how much it costs to run your programs, and we say add everything. Don't worry, you know, I know different grants have different formulas, but in this case, add in your administrative costs, because you cannot do this work without some of that administrative structure. If your executive director went away, it might not be, your program might not be as successful, right? If some of your fundraising efforts went away, your program might not be as successful. If the technology and the software you use to manage your data went away, your program would not be as successful. So make sure you build in all of the costs it takes for you to run your program, and then divide it by the number of successful people. Now you have a cost per success. That is how much it costs to get to one outcome. Now again, write this down. Cost per success equals total program costs divided by number of successful clients. Resist the urge to put number of all clients served, because that's just cost per service. And it does not mean you made everyone better. So take those people out. They're really important. I'm not saying they're not important, but when we talk about cost per success, we have to take them out. So here is the Center of Hope's example. They served, so their program costs were a little over $1 million for the year. They had a 63% success rate. They served a total of 697 individuals, so 63% of that were successful. So that's where they got their cost per success was $2,373 to get one client to successful outcome. All right, so hopefully everyone is tracking how we're going to calculate our cost per success. Now we need to define the societal benefits to our programs. This is where it gets a little more fun, a little more art, but so powerful. So ask yourself, what is the cost to the society for those who are not successful? Now, maybe you know this. We just finished doing a social return on investment calculation for a supportive housing provider. And this was really empirical because we were able to know prior to being enrolled in this particular program, what services and resources and institutions did those clients receive the prior year. So we really did a true like cost benefit analysis because we calculated what was the cost to the society the previous year and what was the cost to the society this year with these individuals in this housing program. So in that case, it's really, really empirical. But sometimes we can't make it that empirical because sometimes we have to infer and we have to go to the research. For example, we did a project for youth out in California, and we went to the literature and we found what is the percentage, or basically what does the literature say for kids who have undiagnosed mental health issues and do not receive treatment, what is the likelihood that they would end up in certain negative outcomes? So what was the likelihood that they would be in jail or in needing more costly services or have loss of income? So sometimes you have to go to the literature and find what research studies say and extrapolate to your data, but sometimes, especially if you have a control group that you're comparing it to, or even a cohort group, you can actually look at what was their cost versus what was your participants' cost. So, that's where something you could contact us and we can help you think about what's the right model for you. But really trying to think about what is the society benefit for the costs that are not successful, or you can also ask yourself, what is the benefit to our community in a positive way, especially if you're doing things like economic development or increased tax dollars or increased income, or so you can either way, right? Sometimes it's they're using more public benefit, or you can flip it around and they're using positive benefit. And so ask yourself, how are you defining this? What evidence or research are you using? And this is going to require you to go to the literature. You're going to have to find some data. So I'm going to walk through what Center of Hope did, and then I'm going to answer any questions that may have come up. So Center of Hope's example was more of that very research-based approach. Let me get my notes here. And again, I encourage you to go download the report because it will have all of the calculations, the sources, the references, and everything that's really important. But in their case, we looked at a bunch of different costs. So we looked at Medicaid expenses, we looked at Job and Family Services reimbursement rates, SNAP, lack of education and future costs, foster care and out-of-home costs, incarceration, recidivism, juvenile incarceration, unemployment, and mental health and recovery. Now, we did not assume that 100% of the clients who were not successful were going to incur those costs. What we did is we calculated what is that cost for one person over a year for unsuccess, but then we also adjusted those costs for probability. So for example, the probability that a young person who was not successful in their programs would recidivate back into the criminal justice system, according to the literature, was only 0.5%. So we did not go and calculate that, whatever the full cost would be, which would be hundreds of, probably hundred thousands of dollars. We just said, what is 0.58% of that cost? So we're adjusting down, right? We're being realistic. We're not overinflating our social return on investment. We want to get to as a real accurate number as possible so that we build trust and we can be a solution into the community. And we're realistic that it's not this pie in the sky benefit, that there is some, we're being realistic. We're showing our donors and our funders that, we're taking a very measured approach. So for the Center of Hope, once you understand your cost, your savings cost, so in their case, it was $16,000. That ended up being the per person savings once we adjusted for probability that those expenses would occur naturally in the community without, because not everyone is going to wind up needing that. So we knew that for every $2,000, we got to one successful outcome. The savings to the community was $16,000. So our calculation is very simple. We basically say, what is the net program benefit? So the cost per person minus the, the societal cost minus the cost per success divided by the program cost times 100, that is going to give us our social return on investment.